Hello, this is Shanelle. Is anybody else on? Rochelle, are you on yet? Okay, well, if anybody is on, I'm just going to place, I have about 8 minutes till 10, so I'm just going to place the lines on mute, and we will get started here shortly. Thank you. everybody. This is Shanelle. I'm showing about 4 minutes till 10, so I'm placing the lines on mute just until we get started. Rochelle, are you on the line now?
I am on the line, Shanelle. Thank you.
Oh, great. Awesome. So for those of you who are on the line, just a few housekeeping items real quick, if you could place your lines on mute to help eliminate background noise, that would be great. I can mute all the lines. I just prefer not to, so we can kind of just keep this informal and people can ask questions as we go along and whatnot. So just sit tight and we will get started momentarily. This is Shanelle again. Since we have a couple of minutes before we get started, I thought just maybe we might go around and see who is on the line. Who all do we have on the phone?
And Shanelle, are you talking about those people who aren't on the webinar portion but are just on the phone?
Yes, sorry, yes.
You don't have to do this now, but you are going to want to read the author's note.
Well, I'm just assuming then that everybody's actually on the webinar portion as well.
I didn't know that, but I heard his. I heard his. Can you hear me?
Yeah, we can.
Hi, Kyle. Yes, we can hear you now. Yeah.
Okay, because I wasn't sure. All right. So is anyone else here? Is it just the three of us?
We have a couple more people on the webinar portion, but I don't know if we have any stragglers that are just on the phone. Is there anybody that's on the phone that's not on the webinar? Okay. Well, I'm going to take it as everybody is on the webinar portion then, and so let's get started. Is there anything that you want to kick off with first, Rochelle?
No, there really isn't, other than the fact that, welcome. I'm not exactly sure who's on the call this morning, but just a couple of reminders regarding MB-QIP, and that is that the EDTC reporting is due into QHI or to Kyle by the end of this month, so April 30th is that deadline. And if anybody needs any reporting assistance with that, make sure that that you connect with Shanelle. And then also that the outpatient measure reporting is due on May 1st. So make sure that you have those deadlines in front of you, since they are going to be coming up here really quickly. And that's
awesome. Thank you, Rochelle. And feel free to jump in at any point, anybody, Rochelle, Kyle, and those of you on the line. Rochelle, I did promote you to co-presenter, so I don't know if that, it says it's promoting, so I don't know if once it's done, if it will let you see everybody that's on or not. But Okay, let's see here. Okay, so first of all, welcome. As Rochelle said, today's webinar is just going to be a very informal webinar for those of you who are typically QHI users, or those of you who maybe aren't using QHI but you're interested in learning more about it. And today's demonstration, at least for the most part, is for those of you who are using QHI. There is a way in our efforts to eliminate duplication of efforts and try to pull data from one location rather than have hospitals submit it to multiple locations, the same thing in different locations. We're trying to find the best way for hospitals to report all the data from multiple projects, like let's say Flex and MDQuip, the HIIN project, the CMS reporting and stuff like that, and try and report it to one location, or at least two locations where we can act as the medium and pull that data and submit it for you on your behalf to multiple locations. So today's presentation is just going to specifically talk about QHI and how you can use it to report your HIIN data for the HIIN project. And I want to keep it really informal, so if you guys have any questions at all while I'm talking, just feel free to interrupt me. If you'd rather not ask questions on phone, you can also use the Q&A that's on the webinar portion. I'll make sure to monitor that, and I'm sure both Kyle and Rochelle will keep an eye on it as well to let me know if I missed anything, if somebody has a question. So real briefly, I know a lot of you are very familiar with HIIN, so I'm not going to go into, hey, what is HIIN about, how did it get started, the background and the history. I am going to quickly just discuss the HIIN measures. I'm going to talk about what's reported and where. I'm going to go over the reporting process, and then we're going to touch on the data collection and submission, which is the comprehensive data system. We call it CDS, that is specific to the HIIN project. And then we're going to go over the quality health indicators, the QHI website, and how you can actually assign those measure sets to your account and where they'll show up and how you can report them, and then kind of give you the spiel on how I can get that information and report it on your behalf. We'll talk about upcoming deadlines, next steps, and answer any questions you have. So real quickly, if my slide will advance. On your screen right now, you will see the HIIN measures. We have a set of core HIIN measures, and then we also have some additional HIIN topic area measures that aren't, they're not required, they're voluntary, that hospitals, if there's an interest, we can help them with and they can participate in. So quickly, you'll notice that about half or 60% of the HIIN measures are all healthcare-associated infection measures. Like, for example, the CAUTI, the CLABSI, the C. diff, and so on. Oh, and I realized part of my list got cut off. I apologize. But so we have non-HAI measures, which are adverse drug events, pressure ulcers, falls, readmissions, sepsis. And actually, I apologize. There are a couple that are getting cut off. It's worker safety. And then, of course, outside of worker safety, there's also patient safety culture, which is an additional HIIN measure. I think they're going to add it maybe as a requirement in the future. And then lastly, MRSA. But again, it's gone from core over to additional as a voluntary. It used to be a required one, but it's not. So what I'm going to do is break it down by two categories for you. HAI measures and non-HAI measures, what's reported and where in terms of HAI and non-HAI. So real quickly, I have this little quick diagram. For all hospitals pretty much in the state of Wyoming, the majority of you, I would say at least like 90% of you or 95% of you, this is critical access. Your infection control nurse or infection preventionist or whomever is reporting the for those of you who don't have an infection preventionist or an infection control nurse, those of you reporting healthcare associated infection data, they typically have an account. Their account is with NHSN, and that is where all of the HAI data it's required that data gets reported to, and that's how CDC and CMS get your hospital's HAI data. It is a requirement, I should say, for acute care hospitals because it's tied to payment, but for critical access hospitals, NHSN isn't required, but it is strongly encouraged because it is the only system out there that allows you to report your HAI data to CMS and to the CDC. So several years ago, there was a project that the QIO underwent, and what the goal was to get every critical access hospital an NHSN account, their infection control person. So for the most part, that is still the status. I think we've only had like 1 or 2 hospitals recently fall off due to staffing turnover, and we're just working to get that remedied. So that's essentially where all the HAI data goes. And because that's the only system used, that's where all the data goes, what we do to eliminate duplication of efforts is we pull all that data from NHSN and we submit it to the HIIN. So the only thing, and all the hospitals have done this, it's a conferring of rights. So when your infection preventionist logs into NHSN, they say, yeah, I want to confer rights. They type in a code, that like a digit code that we give them. They hit enter, and it automatically confers rights to us. That allows us to pull all the data on the back end from NHSN and to submit it to the HIIN project. So now the non-HAI measures, I'm going to break it down into like 4 different tiers because there are 4 options or ways that hospitals can report their non-HAI data to the HIIN project. And that's what I'm going to go over on the next couple of slides. Let's see here. For those of you, if you're not sure if you guys have confirmed rights, please let me know. There is a little bit of there's a step-by-step 1-page instructions for conferring of rights. But like I said, I keep track of all that. So if your facility hasn't, I've already reached out to you and we've already taken care of it. So it's kind of a moot point. But I did put this in here in case you're in transition or maybe you guys, there might be a change in staffing. This is in here as a resource. Let's see here. Oh, and Rochelle, yes, I do. When I actually get into the system itself, I can actually give, I'll be able to share that information as far as who's reporting what. Let's see here. I apologize, my computer's being a little slow today. Another resource real fast, like about CDS that I put in is there's an encyclopedia of measures. There's a link on the slide. This is essentially, for those of you who are familiar with CART and ED transfer communication, each measure set or setting has its own data specifications manual. It's like a step-by-step how-to guide on what the abstraction guidelines are for collecting and reporting data. Essentially, that's what the Encyclopedia of Measures is for HIIN. There's like 1 or 2 pages per measure that just tells you, what to collect and why, like what your numerator and denominator is. I also included a couple links on CDS. For those of you who like to report directly into CDS, these are just links that have like quick how-to guides, like for quick start guides, like how to log in, how to run reports, how to do data entry. Again, it's just a reference or a resource for you guys to use later. But the breakdown for the non-HII measures, this is what we're going to get into. So I apologize if this looks a little bitty, but this is how I'm going to busy, but this is how I'm going to break it down. Option 1, hospitals have a CDS account. They log into that account, and they have the option to enter in their HIIN measures manually. It's simply month-to-month numerator and denominator data for each measure that is applicable to their setting or that they have an interest in reporting. Option 2, there is an Excel spreadsheet that we call the Role Critical Access Data Collection Tool. It's simply just all the measure sets by month, and then it has a numerator and denominator column. We usually use this only in transition when there's like staffing turnover and or somebody is wanting to report for their hospital, but there isn't quite time yet for the next deadline to get them trained. We kind of use this as a transition tool. So we have hospitals who enter the data into the spreadsheet. They send it to me, and then I enter it directly into the comprehensive data system, a data repository or website. Option 3 is for our QHI users. You can enter your data directly into the QHI website, just like you do with your e-transfer, your cart, and so on and so forth. You can assign the HIIN measures in your QHI account. And what that allows me to do then is I can log into QHI, I can generate a report, and I can format it in a file format and upload it on the back end of CDS so it gets submitted to HIIN. And then the final option is, and we've only done this with a couple facilities who were kind enough to be guinea pigs, so we know it works, but it's kind of maybe for, I mean, we can do it for any size, so I don't want to discriminate there, but for like a larger hospital who has a higher volume, we worked with them directly so that they worked with their data programmers and their IT to get a report generated out of their EHR. And then, which unfortunately because of the EHRs, and we know how great they are, or frustrating, they were able just to do it with a couple of measures as like a trial run. And what it did is it allowed them to pull numerator and denominator data on just like 1 or 2 measures. They sent it to me, I formatted it, and I uploaded it on the back end so that they didn't manually have to go in and enter a numerator and denominator for every measure for every month. So that is an option. It does take time and resources to work with IT and a data programmer at your facility, but that is an option. However, for the purpose of today, we are digging only into the QHI function. And just for resource, I put in a screenshot. For those of you who aren't familiar with NHSN, that's the National Healthcare Safety Network. That's where all your hospital's HAI data typically goes, CLABSI, CAUTI, SSI, you name it. And then I put in a screenshot for those of you who are not familiar with the Comprehensive Data System, CDS. This is where all of your HIIN measures are submitted and entered. I just have a screenshot of it as a reference. I'm going to give you a live demo, of course. And then finally, QHI, for those of you who are maybe not QHI users but are interested in it, here's a little screenshot that shows you about QHI. And this is where all the Flex and MB-Clip measures go, and now obviously HIIN. And of course, I'm going to give you a demo of the QHI side as well, at least from a HIIN standpoint. So what I'm going to do is share my desktop. So bear with me real fast. While I'm doing this, does anybody have any questions whatsoever about what I just kind of briefly went over? Okie doke. So this is the login to the Comprehensive Data System for HIIN. Then when a facility logs in, like let's say I'm going to use Campbell as an example. If they logged in, it's just going to default to their facility. If any facility logs in, it will default to just their facility. And I'm going to pick one because you guys I'm not going to allow you to see the data. So let me just make sure I do it correctly on my other side because I'm going to blind it. So give me 1 second. All right. So let's put my blinders on. Okay. Okay, so once you're actually logged into the site, so if you were a facility and you logged in and you hit next, this is the first screen you would come to. I mean, there's wording at the top and a welcome and everything, but I'm not going to show you that because I don't want you to see whose facility this is. So essentially this is what it is. It provides you like a list of all of the measures. And it's going to vary by facility, so only the measures that show up on this screen are like the measures that are eligible for your hospital. So if you're an acute care hospital, for example, you're going to have a very long list. If you're a critical access hospital, your list is going to be much shorter, especially if you don't do, like let's say, surgeries and stuff like that, or have any ventilator-associated condition rates. So this is where a facility would go to enter in their data manually. So I'm just going to randomly click on, let's say, Falls, and I'd hit Enter Data. And let's make sure, hold on, I want to make sure when I hit that you can't see the person's name. Okay, so then it takes you to a screen, and this is where you do like the monthly. So for example, you would hit, like if I want to put my March data in, I'd hit Go. And then I put in, sorry, my internet's kind of slow. yes, data was collected, and then I would give them my numerator and denominator, and I would hit submit. And then I'd hit close, and that would be that. So bear with me. Every time I get out of a screen, I just want to make sure that you can't see the hospital's name. So essentially if you were to report your data in QHI, you would be bypassing all of this right here, and I would be essentially doing it for you. Not manually, but uploading on the back end. As an administrator, let me get to that screen real fast like. There we go. As an administrator, what I have the ability to do is get your data from QHI, format it in a CSV file format, and actually upload it right here. And it will populate all of those fields for all of those measures on that first screen that I showed you. Now, one great thing that you can do in QHI and also out on CDS once your data is in is actually run reports on it, because I know like in QHI the great benefit of that is that you have the peer group comparisons, and I know, Rochelle, you can probably speak to this much better than I can, which allows you to compare your data to the other facilities that are reporting data in QHI, but also statewide critical access hospitals who are doing the same. So this is QHI. This is CDS. This is where hospitals report their HIIN data. So now what I want to show you is QHI. This is where you log into QHI. And correct me if I'm wrong, we have 8 Wyoming critical access hospitals who are currently using QHI?
We have, this is Rochelle, we have 6 who are actively entering data on a monthly basis, and we have a couple more, so total of 8 who are now logged on as users, indicating that the 2 additional are going to be using QHI.
Awesome, awesome. So that's like half of our critical access hospitals. That's wonderful. So for those of you who are interested in wanting to just use one system to report all of your data, and then I can just kind of pick it and, Rochelle uses it for QHI, and Kyle and Rochelle use it for ED transfer and flex related items. I can also use it to pull over your HIIN data. So what I want to show you is if you go to measure sets, what I want to show you is we created a measure set down here at the very bottom. It's called the Wyoming Hospital Association Measure Set. What I want to show you is right now programmed in is all of the non-HAI measures. And you will see, and this is one thing that I get questions on kind of often, is what is confusing is it doesn't, even though it's titled Wyoming Hospital Association Measure Set, it doesn't show up that in the title. Instead, it shows up as HIIN 2.0 and KHC HIIN. I'm sorry, it's a little confusing, but the Kansas Hospital Association, they essentially, I think, are like the owners of this, and they were the ones who originally created the HIIN measure sets within QHI, so that's kind of how they're programmed. But if you'll just know if it says HIIN, that's a HIIN measure. But what you can do is click on measure sets. Oh, sorry, I need to go back. Let me select the hospital real fast, like. Bear with me, guys. Just want to make sure you can't really see who it is. Oh, I know who I can pick because they just got an account and there's nothing in there for them. So if your hospital is logged in and you want to start submitting HIIN data under those measures, you would go to Measure Selection. And here's where it has a list of all of the options, like you'll see here, QHI core measure set. I believe what the ED transfer one's up here as well, ED transfer measure set. Here, Wyoming Hospital Association measure set. You would select that. And of course, you would hit save. And am I forgetting a step, I think, Rochelle, but that should be the gist of it. There's tons of stuff on here. But once you actually select that, then on your, I don't want to go up too high because I don't want you to see the hospital's name. Let me just make sure. So once you select the measure sets you want, you hit save. And I'm going to go back to the home page. Scroll down a little bit. Okay, so now you can't see the hospital's name again. And if you want, I can do a little quick step-by-step screenshot instructions that will show you how to do this, but essentially you log in, go to administration, you go to measure selection, you select the Wyoming Hospital Association group, and then if you want to start submitting data, you go to data submission. Oh. And we need it monthly. That's the one thing, and I don't know, I haven't run into any hospitals having any problems with that because I'm pretty sure that's how it breaks it down is monthly rather than quarterly. But in order for this to work, it has to be monthly submission. So I don't know if there's, Rochelle, just out of curiosity, when they ask for quarterly submission, does it break it down? I mean, does it all default to monthly instead of quarterly? They have to physically select quarterly if they want it, right?
So there are, this is Rochelle again, so all of the measures in QHI are reported on a monthly basis unless it's data that's specifically, so for example, we have some immunization measures that are reported annually, but otherwise all measures are reported monthly. That includes these, so it automatically shows up as monthly. So if you check any of the other boxes, it's only going to be a couple of measures that'll be an option anyways.
Oh, awesome. I did not know that. So when you go to the data submission screen, this is essentially what shows up. It'll be all of the measures for each measure set that you have indicated that you want to submit and report data on. So in here, for example, and are these in like alphabetical order or by like a specific, are they like in alphabetical order or a specific type of order? Because I haven't noticed anything like that. Or, can you clarify, Rochelle?
Yeah, so at the very top, it's going to be just the key indicators that you've selected related to hospital characteristics. So it's basically by category. If you've selected to report on your hospital characteristics, you are going to input that first. Then the next section is going to be the monthly clinical quality measures. They are going to be first, the core measures are going to show up on the screen, and then from there it basically just goes through the various categories within QHI. So you're going to have your inpatient measures, your outpatient measures, EDTC, and HCAP show up at the very bottom.
Thank you.
Assuming the HIIN measures follow that. I haven't focused on the HIIN measures specifically, but if you scroll down and if the HIIN measures were selected, I'm assuming that those are going to show up at the bottom. Now keep in mind that some of those HIIN measures are also core measures. So you see the readmission measure that's in there? That is also a QHI core measure. So you will input that data one time. It's obviously stored in the tool for wherever it's having to be reported. You never have to report any data in QHI more than once.
Awesome. Thank you for clarifying that, Rochelle, because that's what I was always that's what I was curious about. So yes, as she said, you'll see here I highlighted that you will see that the readmission, while it says it's a HIIN and a HIIN measure, it is a core measure for QHI, so that is why it's in this list. But as Rochelle stated, if you scroll down here to the bottom, I start seeing all of the HIIN measures in alphabetical order, actually, it looks like almost, for the most part, by measure number at least. Are down here. So what this allows you to do is to actually enter a numerator and denominator in for each one of the HIIN measures that you wish to report on, non-HAI. So that would be, your falls, your pressure ulcers, your sepsis, your readmissions, your adverse drug events, which are like excessive anticoagulation, hypoglycemia, and opioids. Anyways, but what you would do is you would enter them here, and then what I typically do is twice a month, usually in the middle of the month and at the end of the month, I go out and I run reports on the facilities who report HIIN data to QHI. However, there are a couple facilities who will email me, for example, I'm going to use PAL as an example. PAL just sends me an email and says, hey, Shanelle, I have all my data submitted in through March, so you can go ahead and start running your data for HIIN. So then I know that it's done and they're not going to make any more changes to it. And then I go out and I pull it and I submit it into CDS for HIIN. There's also a feature recently that I've been playing around with in QHI, which I don't want to get into too much detail, but there's a way, for example, Weston County, Joanne, I'm going to throw you under the bus here for a second, that they can actually assign email addresses to generate reports. So once they've either entered their data or have a certain data set accomplished, then it emails the people that they have actually added emails for so that they get their final report automatically or a notification. Did I say that wrong, Kyle? I'm sorry, Rochelle. Does it actually email the report or send you a notification to go out and run the report?
I'm not exactly sure what you're talking about. I mean, you can schedule it so that reports are automatically generated for you, and then you get emailed a report on a monthly basis or a quarterly basis or whatever, however often you want those reports.
That's exactly what I was talking. Yeah, that's exactly what I was talking about.
Yeah. So you actually go in, and there is a I'm not sure if I have. Do I have some capabilities to use?
Here, I think I can turn it over. Let me see if I can turn it over to you. Let me just move that facilities real fast. Like I can go. Still says it's.
So I was just referring to the screen that you were using there.
Oh, okay.
So
this one?
Yeah. So if you go out onto the home page, you can select the reports option on the far left-hand side, and on that left-hand side, it's to generate reports, and you select that, and then you can indicate what that report name, what you want your report to be named. So let's just say monthly HIIN report. And then you select those HIIN measures that you want to show up on the HIIN report, who you want to get that HIIN report, whether it's somebody in your facility or it's you or whoever you want to select to get that. Then you indicate the date that you want that report to go out, and then you just hit enter or submit, and the report then will automatically get generated until you either go back in and say you want that report to be stopped, and or if you went in and originally indicated a stop date when you set the reporting feature up. So it's just something that you can use to automatically make sure that those reports go out. And those reporting features apply to every single measure that's in QHI. This isn't something that's the HIIN. This is just a QHI reporting piece that is available and that most of our CAHs are actually using already.
Awesome. Thank you, Rochelle. So as most of you are probably aware, Rochelle is the QHI expert, not me. I'm a novice. I know it enough just to go out and get all the HIIN stuff and run reports on all the data that's out there. And that's pretty much my knowledge base of it. So if you have any questions or run into any problems when you're flagging the Wyoming Hospital Association measure set, please let Rochelle or I know so that we can help you with it. But just to recap, and we're not going to see any data, so it doesn't matter which facility I randomly select, but this is the home page when you log in. You would go to, excuse me, data submission is where you would enter the data, reports is where you would run the reports, administration is where you would select the measures. So you'd go measure selection, measure selection, you'd scroll down, you would check Wyoming Hospital Association measure set, and you'd click save. That's it. Yeah. Then when you start, go ahead.
So I don't know about everybody else, but if you're doing like some piece on the computer, we don't see it. Or at least I don't see it. There we go.
Thank you, Rochelle. Sorry, I don't know why that wasn't popping up. But okay, so just to recap, this is the screen you see when you log into QHI. when you log into QHI to select the Wyoming Hospital Association HIIN measures so you can see them and report them, you go to Measure Selection, and then you select Wyoming Hospital Association Measure Set, then you click Save. That is it. Then when you go to log in, or if you're already in, you go to Data Submission, and you can start entering your data by finding those measures down at the bottom of the measure page. And that's it. So does anybody have any questions about that, or concerns, or comments?
So this is Rochelle again. So I just want to clarify, what makes this process maybe more streamlined for people. Is it that when you're doing your data submission piece of this for each one of the measures, all of the measures are right there on the data submission page, so you don't have to go through and keep clicking on each measure to enter your data into that other tool that you showed us? Is that one of the benefits of using QHI versus that other thing that you were showing us earlier?
Oh, yeah, absolutely. So, yeah, just to kind of to recap on that, there are multiple ways that a hospital can report to the HIIN project into the CDS system. Some do it manually into the site itself, but what we were thinking is for QHI, since, let's say there's the 8 that are getting ready to report their data using QHI for other projects like MBQuip, QHI, Flex, all of that, why not give them this one location that they report all their data to save time and so that it's all in one location for them? So for those of you who put your HIIN data in here, then your HIIN data will be here along with all your other data. It's just one data repository for you to use. And by me having access to it, I can just pull it over and submit it to the other project or future projects if there's any other ones that might be coming down the pike that you sign up to participate in. That way, you don't have to have another login. You don't have to have another password you have to remember, another system you have to learn to use. The one thing I would say about CDS, if you don't do the data entry directly, they do have some great reports out there and resources, but so does QHI. So I think from the Flex standpoint in Wyoming, I think we're really trying to encourage more Wyoming critical access hospitals to use the QHI website because it does have the ability for you to report all of your measures for these projects out here and have it in one central location and one system for you.
Great. That's really helpful. One thing I should note, Shanelle, for anybody that's not a regular user of QHI and is just going to be using this initially for your HIIN initiative, you'll see at the top of that screen up there that Shanelle just had. Could you just scroll up a little bit, Shanelle, on that screen? This is one piece that often gets forgotten, but it says there, activate data for reporting. There's a little checkbox there, and then it says save all and stay. You have to after you're done entering all of your data, you have to check that box and then click the Save All and Stay. That makes your data available not only to you for reporting purposes and for Shanelle to download, but also if there's any benchmarking that's taking place. So let's say the other CAHs in Wyoming want to do some benchmarking with CAHs in Wyoming or even Kansas or the other states that are using QHI for their CAHs. That makes your data, not your hospital name associated with your data, but just your data available to those CAHs so that it gets pulled into that whole benchmarking mechanism that's in the tool itself.
Just to make sure, can you see that I highlighted it on the screen? And can you see that option you were just talking about, Rochelle?
Yep.
Okay, good. The one thing I also want to mention is if I go, and you don't have to remember this, but what I want to show you is, again, these are the measures within the Wyoming Hospital Association measure set for HIIN. That, like I mentioned before, they are healthcare-associated infection measures. So that means the healthcare-associated infection measures like your C. diff, your MRSA, your CLABSI, and your CODI, those aren't out here. And what we're trying to do, I am working with the QHI folks to try and do an import of HAI data. This would allow me, so going back to that data entry screen, I'm sure there's a better way to do this, but just to show you here, it's at the top. You see here there's an import cart data, and then there's an import for your ED transfer communication data. This allows you to import the data from those applications to make it available out here in QHI. What I am trying to do is, as I mentioned earlier, the majority of the hospitals in the state, both acute care and critical access, report all of the HAI data to that NHSN website. It's the pretty much only secure CMS-approved way to submit and report HAI data. So long story short, I have access to that data repository, and what I am trying to do, we're able to collect it and pull it over for the HIIN project so that, again, the hospital just does what it always does, reports it to NHSN, doesn't have to worry about sending it anywhere else because we do that for you. What I'm trying to do for the QHI hospitals is import the HAI data into this website, into the QHI website, so that you have, again, not just the non-HAI HIIN data, but all of it, the whole kit and caboodle. So it's all out here for you to see and use the QHI website for that information. So, but again, it wouldn't take any work on your part or any requirements on your part. It's just something that I'm working to do so that you guys will be able to see it in this system for your hospital. Any questions?
Shanelle, do we have any CHs on the call who are using QHI right now for their HIIN data entry?
Yep, let me just go back here. Let's see some of the names. Yes, Joanne, I'm going to throw you under the bus. Joanne at Weston is using it, and I know that Sarah Welling at Powell is using it, and we have, but I don't see Sarah on the call. We also have Renee Miller and Tracy Walker who are using it at North Bighorn. And I'm trying to think of the others. Let me go pull up my cheat sheet and see what I can find here real fast. So definitely those three for sure. Let me.
And I don't know if, Joanne, I think you're on the call. I can't tell. But, Joanne, if you're on the call, any kind of thoughts that you have in terms of doing it this way versus any other way that you've been using the tool, or anybody else that you mentioned who's actually using it?
This is Joanne, and it's just easier. And I think I've said this before. It's easy for me to do like graphs for a board report, and I do that quarterly for our board and do some comparisons. I can customize to whatever they want to compare to, and a report I can customize per quarter depending on what they want to focus on. So I find it very, very user-friendly, and also it just saves time because you can put data in one place and just easily upload it to other reporting sites. So it's nice.
Great, thanks.
Thanks, Joanne. We also have, and I don't see Amber on the call, but Amber from Crook is also starting to use it more, is using it, and Niobrara is going to start using it as well. So that'll be, 6 or 5? Can't count today. But the goal is to eventually get all of QHI users, hopefully, if they wish, to report their HIIN data this way. So again, as Joanne said, it's a system all of you are familiar with. It's a user-friendly system. It's one location to have everything. Any questions? So upcoming deadlines, as Rochelle mentioned, and the second set of reminders are going to be going out this week. Your outpatient data is going to be due May 1st. Your inpatient data is going to be due May 15th. Your ED transfer data is going to be due at the end of this month. And for HIIN, so that's all Flex and MBQuip deadlines. And for HIIN deadlines, really, let me see if I could just share something like that. Let me go back to sharing my desktop real quickly. Give me 1 second. Oh, it logged me out. For the upcoming deadlines, there's just 2 things. By the middle of May, this one's kind of like a forever moving target or a deadline, I should say. We just like to get an updated needs assessment from each of the HIIN hospitals on an annual basis. And really, the needs assessment is just a series of questions related specific to the HIIN measures and patient and family engagement and worker safety. So, for example, we would like for the hospitals to do it, yearly, but sometimes that doesn't happen. So what we're trying to push for all the HIIN hospitals to do is get an updated needs assessment by the middle of May, end of May at the very latest. So what I will be doing is just verifying the dates of all the latest needs assessments and then following up with your hospital individually. The second thing I wanted to mention is data submission. So first quarter 2008 data is going to be due by the end of June, June 25th. So what I'm going to be doing in the next week or so is sending out, well, hopefully this week, sending out reports to your facility on 2 things. One, what we've noticed is that there are some gaps in the baseline data where like a hospital maybe submitted 9 months, but for whatever reason they're missing like a whole quarter's worth of baseline data. So we're just going to be sending out a report that shows you where any gaps are or missing data might be in your baseline data for each one of the HIIN measures that you've been reporting, so that if you have the time and are willing, we would like to strongly encourage you to go out and fill in the gaps. Like a couple hospitals are only missing like a month in their baseline. It's kind of odd. So we don't know if that happened with the data pool or whatnot. Secondly, it's just the monitoring data, the stuff that we've been working on, concurrent reporting since the beginning of HIIN. So your first quarter data, January, February, and March, is going to be due by the end of June. I believe they're also going to be asking for 2 additional months, which I'm currently looking to get clarification on. So essentially, it's just that going forward, something we're going to strive for HIIN is that your data that's due is by the end of the next month for the previous month. So for example, let's say at the end of April, your March data is due. At the end of May, your April data is due, and so on and so forth. Because as we move forward into the next year of HIIN, we want to encourage concurrent reporting so that we can just focus on our quality improvement efforts and not data submission. We want to move away from that. We just want to be able to use the resources in time for QI. Does anybody have any questions related to the upcoming deadlines? Anybody have any questions at all about the, let's see if I can get that up, the actual submission process and the options that you have available, or simply just about like the QHI data entry and submission and how that works? Okay. Well, what I will do, I know we'll have this recording available, but I think maybe, Rochelle, just for your input, is this going to be available out on the our Quality Improvement Matters website for the facilities?
Yeah, so I'll post on our www.wyqim.com website, which is where we're posting all of our MBQIP and QHI-related items for Flex. I'll post both the presentation and then, Shanelle, I think you're recording this, so I can include that recording as well.
Yes, and one thing that I'll do just is I'll just create like a quick 2-page step-by-step screenshot on how to log into QHI, select that measure set so that they can make sure they see it so that they can start reporting it in QHI just as a reference. Otherwise, unless you have anything you want to add, or Kyle, is there anything that you would like to say to the group before we wrap up?
Rochelle doesn't have anything to add other than just so people know, I'm going to be putting this under the QHI, in the QHI section of the website. For those of you that have used it, there's pull downs for each area within MBQIP, and I'll put this inside of the QHI section on the website.
Awesome. Well, thank you, Rochelle, and we will be sure to notify all of you of the recording and the website and the slides and its availability so that you can use it as a resource in the future. And feel free to reach out to myself or Rochelle if you have any questions related to reporting and HIIN and QHI. We'll give you 15 minutes back of your day, or 12 actually. Thank you for joining, everyone.
Thank you.
Thank you.